I work for NHS Supply Chain. I'm a senior category tower manager. I have responsibility over orthopedics and ophthalmology and cardio and audiology towers, but I'm also the lead for a number of NHS E&I facing projects, one of which is MTFM. So if we could go to the next slide, please. Great. So innovation is a key work stream for NHS Supply Chain, and we understand that it's critical for meeting customer needs, namely to improve patient outcomes, creating financial benefits, and meeting the net zero targets of the NHS. The Innovation Portal is the front door for innovation to the NHS, and when it was established in 2019, NHS Supply Chain was considered to be the delivery partner for the system. But over the last couple of years, we worked very closely with NHS E&I, and we found that we can add further value by working with them throughout the process rather than just being a delivery partner. Before I move on, just the link at the bottom of the page will be useful for you to access further information on NHS Supply Chain's innovation tools, but it's very easy to find. If you just go onto the NHS Supply Chain website, search for innovation, it will bring up all the relevant pages. Next slide, please. So we affectionately refer to this as our totem pole for innovation. It just describes the process through which products travel as they go through the innovation process with MTFM. As you can see, NHS Supply Chain inputs at every stage of the process, which allows us to impart procurement specific and commercial advice throughout the process, which involves us letting everyone know about the supplier and product market information that's relevant. And we contextualize this with clinical insight and product safety insight, which comes directly from our CAPA function. It's just worth noting that products can come in and out of the process at any point in this because we can let the team know about any equivalent technologies that exist in the market that can be evaluated alongside. So if we just move to the next slide, please. Critically, why should you buy through the NHS Supply Chain? Well, there's a number of reasons, most of which I'm sure you're aware of, but one of which I want to focus on in the next slide, but we'll stay on this for a second. So we're a well understood transactional route to market for the NHS. You will all have worked with us in the past. You should have people within your organisations that intimately understand how to use the NHS Supply Chain catalogue and can easily order products from us. So it makes life easy for you. Additionally, we have a wide variety of legally compliant, nationally procured framework contracts via our partners, the category tower service providers. So again, no additional procurement work required for your organisation. Critically, we provide direct reporting of transactional activity to NHS E&I in collaboration with this project, which enables the accurate funding of your innovative technologies through pre-agreements with your commissioners. So once you've agreed funding for the products with your commissioners, we will provide the necessary financial transactional information to them to ensure that you are funded correctly for those products. And lastly, on this slide, we provide delivery of reporting savings to agreed and understood methodologies. So any savings delivered by these projects will be reported through your usual CRM account managers to add into your CIP targets. Next slide, please. So my last slide is an important one because it details the process in two different ways for MTFM procurement. Along the top there, you have the process if you order through NHS Supply Chain. You can see that the transactional aspects are taken care of by NHS Supply Chain. You simply need to raise an order with us. Then the goods are delivered to you. You pay NHS Supply Chain. NHS Supply Chain pays the supplier, and data is transmitted to the commissioner on your behalf so that you are reimbursed appropriately. The lower pathway shows what happens if you purchase directly, and really the key point there is the fourth box along, which means you have to trace the usage of those 11 MTFM products back within your organisation in order to ensure that the commissioner is reimbursing you appropriately for those goods.